We're super excited to be here today chatting about unlocking the potential of artificial intelligence in healthcare. We'll be covering a handful of topics and hearing from 3 different thought leaders from Elation. For those of you who are new to Elation Health, our story started in 2010 with a simple, modest vision to build an EHR designed to support the way physicians deliver primary care. The cumbersome legacy billing-first EHRs launched 2 decades earlier in the 90s, introduced inefficiency, cost, and a heavy documentation burden. And Elation's founders, Keena and Kanan, knew there had to be a better way. So they joined forces and leveraged Keena's computer science and economics expertise with Kanan's health finance and management expertise to build the first clinically focused EHR purpose-built for primary care. It was designed around their father's family medicine practice with a personalized, relationship-focused style of caring for patients. A clinical-first philosophy is the radical idea that technology can provide physicians with the freedom to focus on their patients. It's technology designed to support rather than disrupt the delivery of care. Now today, almost 15 years later, Elation serves over 34,000 clinical users across all 50 states, caring for over 17 million patients with the leading technology platform for high-value primary care. Okay, let's introduce today's speakers who we are honored to have with us today. First up, we have Ken Worthy, is a staff product manager at Elation Health, leading the strategy and development of our AI-powered products. Over his 4 years at Elation, he has driven solutions that help practices of all sizes to scale while maximizing usability for clinicians at the front line. With nearly a decade in the tech industry, Ken Worthy excels in guiding multidisciplinary teams through ambiguous challenges with high potential for impact. He is deeply passionate about how technology can be used to empower people to focus on what is most meaningful to them. Before Elation, he held product management and delivery roles at LiveRamp, Visco, and Sprinkler. Next, we have Phil. He has been working in software engineering roles at healthcare startups since 2000. The first chapter in his career was focused on using technology to help prevent medication errors in hospital settings. He joined Elation as the first full-time developer in 2010 and is currently VP of Engineering, focused on technical strategy, including all things AI. Phil's a reluctant technologist who believes strongly in pragmatic and empathetic applications of technology through thoughtful, human-centered design. And next we have Katie. She has been a part of Elation's design team since 2021, where she now leads the EHR design strategy. Previously working in healthcare technology as a UX researcher, she transitioned into doing both design and research in order to simplify the everyday lives of clinicians, believing that good design can truly transform the way people work. Most recently, Katie has been excited to work on new AI products, tackling the unique and complex design challenges that they present. And Katie believes that everyone has a bit of designer in them. Her role is to help bring that out. Now, let me briefly go over today's agenda. First, we'll explore Elation's guiding philosophy and core principles for the safe and effective integration of AI into the EHR platform. Then we'll discuss the importance of seamlessly integrating AI into clinical workflows and understanding why and how we need to prioritize clinician trust in the design of AI solutions. And finally, looking to what's next, we'll share how AI can further alleviate documentation and reduce administrative burdens in primary care. So let's dive in and learn together. Ken Worthy, the floor is yours.
Thank you. Welcome, everyone, and thank you so much for joining us today. Over the past year, we've embarked on an exciting journey, learning and creating AI solutions that are tailored to primary care. This period has been incredibly dynamic with rapid advancements in technology and significant excitement in the market. and we're really eager to share our experiences and insights with you today. Next slide. Before we dive in, we want to get a sense of who's in the room today and the experiences that you've had with AI already. We have a brief poll, which should be popping up on your screen now. And let's just take a few moments to complete the poll as we get started. Okay. Wow, very, very exciting. All right. Thank you all for completing that. So the verdict is in, and it appears that most of you have moderate experience already using AI in your practice. Well, you are in good company, and we hope that this presentation inspires new ideas and fosters meaningful discussion about the future of AI in healthcare. Okay, the next slide. All right, so in this section, we're going to spend a little bit of time really understanding the problems that are presented to us in healthcare and how the emergence of AI as a promising solution has evolved since the start of this year, as well as spectrums of approaches that we've learned and observed over the course of the last year working on AI products. Next. Next slide. Sorry. Okay, so let's begin by addressing the longstanding challenge of documentation burden. This is a problem that we are continually thinking about at Elation, and much of the industry is continually seeking out solutions to. We know that on average, physicians spend over 16 minutes per patient encounter on electronic health records, dealing with chart review, documentation, and ordering. And beyond clinic hours, they spend an additional 1.77 hours documenting, and a significant 58.1% of physicians feel that the time they spend on documentation is excessive. Moreover, documentation burden contributes to about 53% of physician burnout. So this not only affects the clinician's well-being, but can also impact the quality of patient care. And most importantly, this impacts the long-term sustainability of primary care. Next slide. So with the emergence of AI technology, the industry recognized that AI was a promising solution to address this longstanding challenge of documentation burden. We saw the market really rally around this use case with meaningful investments in AI scribe companies. Just to illustrate that, between Q4 of last year and Q1 of this year, we saw around 120 million in investments going toward companies that were using AI to address documentation burden. We also continue to see meaningful partnerships between health systems and these companies, reflecting growing interest and confidence in these technologies. So next slide. At Elation, we rely on our strong relationships with clinicians, and we wanted to hear directly from our customers how they see AI fitting into their workflows and what adoption of AI looks like to them. From a survey of physicians earlier this year, about 30% stated that they were currently using AI scribe tools for documentation. And for those that were using these tools already, they were using it for about 80 to 100% of their encounters, indicating that they were finding strong value in these tools at the onset. Reflecting back on the poll from earlier in this call, many of you indicate that you're already using AI in some way, shape, or form in your practice, or that you have experience with AI already, which reflects this continued trend toward AI adoption in healthcare that we are also seeing. On the next slide. So one thing that was really clear to us from the engagement we were having with our clinicians was that they felt really optimistic about AI improving efficiencies in their care delivery, especially with reducing pajama time. And they shared, next slide. And on the next slide, you see that they shared the most optimism with AI helping across 4 key areas. They saw AI helping decrease their stress and burnout, increasing their time and focus, decreasing cognitive burden, and increasing their joy in practice. These insights from our clinicians have been so instrumental to us over the course of the year, and we continue to collaborate closely with them to turn this optimism into value that they can experience every day. Next slide. So as we went into this work, we also recognized that when it comes to bringing AI into the clinical experience, there are a variety of philosophies and approaches that we could take. The key thing that is being traded off on, however, is the degree of patient context and workflow integrations that clinicians can have. On one end of the spectrum, you have AI that is built as a first class capability in the EHR, ensuring that it becomes a natural part of the clinical workflow. There are bolted on integrations, which can be added to EHRs, but with limited context and workflow integration. And then there are standalone tools that really operate independent and outside of the clinician's natural workflow, having some cognitive burden on the clinician to essentially manage both sides of that workflow independently. We experimented across this spectrum over the course of the last year, but ultimately we learned that the best path forward was to build AI as a first class capability. And I'm really excited to hand it off to Phil to share a bit more about that.
Yeah, hi, welcome. I'm going to talk a little bit about the decision that Kenworthy noted and why we've chosen to really deeply and natively integrate AI into our platform and what advantages that decision unlocks for our customers. Next slide. All right. First insight, context is key. Probably obvious in retrospect, but a really clear learning in experimenting and exploring these tools with providers is that just like providers benefit from being as close as possible to as much patient context, so does the technology and the tools. A lot of the innovation that's happening in AI is happening in third-party systems that are sort of purpose-built for instance, doing AI scribe or other tasks. And they generally have pretty limited integration capabilities with EHR platforms. So providers are often pulled out of their EHR, juggling two platforms. And further, the systems themselves tend to lack rich context about the patient. So your AI scribe tool may be suggesting diagnosis codes, but without knowing about the patient's existing problem list. Probably isn't aware of the provider's visit note templates that you spent a long time curating in your EHR. And so as a provider, you also may lose the note as the agenda for your visit. We saw this as a real challenge, and we think it makes it more likely for these systems to provide inaccurate results. The technology broadly presents a bunch of unique challenges when it comes to testing for accuracy and eliminating bias, and that's also a hard problem to solve building these AI systems, but one where we can be much more effective when we have context about the patient and also end-to-end context about the workflow. So we can measure and learn from edits that providers make to generated content. We can check predictions against ground truth in the patient records, and all of those things make us more capable of being like a trustworthy vendor. All in all, we saw this as an opportunity and a responsibility. We can infuse these tools with context from the patient's chart and deeply integrate them with the provider's existing workflow. So Note Assist lives directly in Elation and in the visit note workflows. It's aware of what's in the note and it populates your visit note templates. And going forward, we'll continue to enrich its awareness of the chart and build tools that take advantage of this insight. Next slide. A second takeaway from the technology side of the organization is that agency is everything. So when it comes to AI, maybe the only constant right now is change. All of us are learning and moving really quickly. And we recognize at Elation that it was important for us to take responsibility for the end-to-end experiences that our customers are having with these tools. And that also means having the ability to adapt quickly as we learn and as things change. A pretty typical posture in the EHR space would be for us to rely entirely on third-party integrations for novel technology solutions like AI. You'd maybe buy an AI scribe tool and we'd work with that company and ensure the integration works as well as it can. We do a lot of that at Elation, but it does mean that the solution requires a good deal of coordination, and changes involve synchronizing work against multiple clinical products and companies. And also our vision for how AI may reshape clinical workflows and really make an impact on administrative burden requires more agility than that. And we think we're in a really unique position to provide it. Elation has several advantages that make building this technology native natively in-house a pretty clear decision for us. We have a bunch of enthusiastic and engaged customers that are really excited to give us feedback because they know that we'll take it and improve the product. We have a mature EHR platform that we can easily incorporate new technology into. We've built in-house technology teams that have been able to prototype and iterate on AI features really quickly. And we can make really frequent iterations and deploy them in a very modern technology stack. Additionally, this strategy means that we can work with third parties to deliver experiences we may not be building, but we can also build experiences that don't justify an entire company to use AI. We're really excited about finding small opportunities to use AI to remove paper cuts in the clinical experiences and produce sort of like magical encounters on the margins and not just larger product offerings like Note Assist. So developing these capabilities within our team enables that. Next, Katie's going to talk through principles that our design team is using to guide this work.
Great. Thanks for queuing that up, Phil. Yeah, I'm going to talk about a topic that's super close to my heart personally, and talk a little bit about how we're thinking about designing for clinician trust, and specifically in the context of designing AI products for clinician trust, although really all of these learnings and principles that I'll cover apply more broadly and are things that are based on design principles we've held at Elation in the past. I'm going to cover three main principles that have been guiding us in this process: tightening the feedback loop, keeping clinicians in the driver's seat, and considering the full workflow. And then I want to ground that conversation in specific context about the AI-generated note documentation that we've been working on, as well as what we've learned from that process. So starting by talking about tightening the feedback loop, as Phil mentioned, we've invested a lot in being able to iterate quickly. And the first line of defense for us on that is definitely going to be evals and the testing that we're able to do prior to release. But it's super important that if we're moving quickly and iterating quickly, that we're making sure that's translating into the impact that we're intending to have. And so one of the things we've done towards that end is building in-app feedback specifically for our note generation product. And that's really helped us learn at the speed that we're moving. And that was kind of a learning for us, was making sure that our feedback was keeping up with the pace of development. And so that's been really helpful. And the other thing it's helped with is helping us navigate the fact that there is randomness with building an AI system and making sure that we're able to get enough volume and signal to really see where patterns of issues are arising and be able to react to those quickly. One of the other ways we're thinking about our feedback loop is to keep thinking and referring back to our North Star, which is to be working towards touchless encounters where clinicians really are having a touchless experience with the EHR. It's obviously a very lofty goal, but practically there are ways that we're looking at that today and iterating towards it. So one of those is quantitatively, we're assessing the distance effectively between the note that we're generating every time and what the provider finally signs off on. So we're looking at how much of a change there is, and we really want to see that number coming down over time. And then to supplement that, qualitatively, we're looking at what types of changes are providers making and what kinds of changes are those and which ones are the most difficult. So you can imagine, completely reorganizing the structure of your note is going to take a lot more time than maybe some quick edits. So it's important also that we're getting that qualitative input and understanding where we can invest to make sure that there's the least amount of effort going into cleanup. Next slide. I'll go ahead and cover how we're thinking about keeping clinicians in the driver's seat. So it's super important to us that we're building tools that are enhancing the expertise of the clinicians and not overstepping into the territory where AI is making decisions without appropriate oversight. The power of these AI tools is often that it enables us to really anticipate what a provider needs. And therefore, we can lower a lot of admin burden associated with their work. But it's, it can be a really slippery slope into overstepping. And one way, we can see that is showing up is in documentation generation. We'll have a recording of a transcript or, of an encounter. And then a lot of that conversation is going to happen in kind of like normal layperson English. Rather than medical terminology. And so one thing we're doing, right, is translating that maybe non-technical language into medical technical language. But it's really important that we're not overstepping into the territory of making assumptions about what the provider intended to be doing or what they intended to be capturing, and that we're still leaving those kind of decisions in the clinicians' hands. So we really want to make sure that we're representing that conversation faithfully, but thinking of ways that we can still get the most leverage out of anticipating their workflow. One way that's shown up for us is in diagnosis coding and thinking about ICD codes, where we can extract from the conversation their thinking around an assessment. We can organize their assessment and plan based on that, and we can capture whatever the provider said in terms of a condition. And often that gets them close enough that they are just one click away from making a really concrete decision about what that diagnosis is, without us having to leap towards making that thing they're so responsible for clinically and legally on their behalf. And then in terms of us like continuing to improve that experience and really filling in those gaps, another place we're really excited about is leveraging context from the rest of the chart or from their templates in Elation to supplement that transcript information. So we can look at the patient's problem list, or we could look at the provider's templates and use that to have much higher confidence in the suggestions we're making or the anticipation we're doing, rather than just relying on maybe a prediction from AI. The other way we're thinking about trying to maintain clinician control in this experience is to recognize that with AI documentation generation, clinicians are moving from the space where they're primarily authors and they're writing a lot of content to being in a space where they're having to review a lot of content. And we want to make sure that that's not just shifting the burden from one type of burden to another, and instead being really thoughtful about that experience of review and making sure that we're supporting them in that work as well. So in our creation of the documentation, our focus there was really on having structure and format, which are useful outside of AI documentation. They also just make it more generally easy for other collaborators to read, but it becomes really important if you're having to review the content that it's easy to scan, easy to notice if something isn't matching your expectations. So we're breaking things down into logical clinical groupings or discrete fields when it's appropriate, which is much easier to review than a large narrative paragraph form. And then also, we're going to continue to highlight AI-generated content throughout the platform, because it's definitely something, at least at this point, how we're thinking about it is it's going to require a different approach to review for somebody in the practice than content that was authored by somebody else in their organization or pre-templated. And so it's important that we're calling that out as something that requires review. Next slide. Finally, I'll talk about how we're thinking about this in the context of the full workflow. And this, again, applies really to all of these products. But when we're thinking about the documentation generation, one thing that differentiates us a little bit as an EHR is we're really accountable to the success of our customers at the end of the day. And we want to make sure that clinicians on Elation are effective PCPs, and we want to be supporting them in that. And so our work isn't just focused on, reducing the admin burden associated with documentation, but instead we need to be thinking about holistically, like how that fits into their workflows. So one way that's shown up is we made the decision to generate notes in parallel with the visit. And there are a number of different reasons we thought that was advantageous, but A couple that I think speak to this focus on the full workflow is one, we see the note as currently and continuing to be a really key work surface for clinicians, both in terms of setting and maintaining an agenda throughout your visit, as well as being a really key place to have clinical guidance or recommendations surface to you. And to date, or if you're not using a scribe, it's some place where you're like actively capturing information about your visit that helps engage with both of those things. And so losing that was going to be something that we thought would potentially hurt clinician workflows, and was really important for us to be progressing towards like having that continue to be the case, even if they weren't manually documenting. And then the other thing is that we know how precious the time is at the very end of visits and between visits. So if you're wrapping up with a patient and we haven't yet generated your care plan, it's something you can't review with the patient, which might be a really critical gap. And then also, if you only have a few minutes before your next patient, which is often the case, and we take those few minutes to be generating your visit at the end, it's not going to get done right before you see the next patient. It's going to sit till the end of the day. You're going to have to switch back into that context to finish it out. So the faster we're able to generate the note by the end of the visit, the more time you have to make those last quick edits and reviews, and hopefully be able to sign off on that before you're in the next patient visit. The other thing we've been thinking about a lot as we're building these AI tools is how do we protect documentation quality? So the last thing we want is to be reducing the burden of creating documentation, but then generating junk documentation. Documentation is obviously super important for PCPs to communicate with the rest of their care team or with their patients. And the problems that we've been hearing about as an EHR, and the challenges we've been trying to solve around how am I more effective as a PCP? How do I get data and clinical insights out of the chart? Those don't go away, and we want to make sure that even if we're generating some of that documentation with AI, that quality is still there, and that those notes need to build on top of that longitudinal record. That structured data is still really important. And this is actually something I think we're quite excited about as a team, and think that there's a lot of potential here to actually drive up the quality of insights and have even more structured data in your notes than is reasonable to expect of providers documenting manually with the time that they have. I'm going to hand it back to Kenworthy.
All right. Thank you so much, Katie and Phil, for going over the context and some of the decisions that we've made when it comes to building AI products. As Katie alluded to there at the end, we recognize that documentation is a significant challenge that clinicians face, but we also recognize that there are many other hurdles in providing care. And our vision is to expand AI's role beyond just note generation to address these broader challenges. And next slide. Yes, as we continue to engage with clinicians, which is something that we continue to do at Elation and just take very, very seriously. We want this to be a collaboration with clinicians. We've learned of 4 key areas to drive impact. We hear that clinicians are commonly distracted from their clinical thinking by documentation requirements. We hear that they are struggling to find insights from the data that they already have. We hear that clinicians are spending too much time on work that could be completed by others on their teams, and they struggle to manage their patients' outcomes beyond the 4 walls of their practice. Next. And on the next slide, just kind of thinking about how we see the future and how we see AI transforming the relationship that clinicians have with their technology. We really see the EHR transforming into an anticipatory system that acts as an assistant to the clinician, allowing them to focus on their patients and not the documentation. We believe that technology can proactively interpret high-impact patient data, enabling clinicians to make informed clinical decisions. We see the EHR facilitating the delegation of tasks to appropriate team members, ensuring that clinicians can focus on work that matches their unique expertise. And finally, we believe that the technology can take responsibility for coordinating the work for the care team and become the source of truth for tracking them. Next slide. As you can imagine, there's a lot of work for us to do to achieve this vision, but we are starting with enabling clinician focus with Elation Node Assist, which is AI-powered documentation that is deeply integrated into Elation. We learned from clinicians that this is where a lot of the pains are most acutely felt today, and this was an area that they wanted us to focus on when it comes to deploying AI. Clinicians that are, next slide please, the clinicians that are using this product have had positive feedback to share with us, and we continue to work collaboratively with them to improve the product. They've expressed how it has impacted their day and the value that they're getting from using Node Assist. And we continue to feel very lucky and privileged to be working really closely with clinicians on this very, very hairy problem and integrating this new technology into their workflow. Next slide. All right. In that collaboration, some of the key ways that clinicians have highlighted this technology really impacting them is that it enables them to capture every relevant detail, improving patient care and outcomes, and they also experience faster documentation, saving about 2 hours a day on clinical documentation. So we're really, really excited for the challenges that comes with doing this work, especially in close collaboration with our clinicians. And we are excited to continue to learn and have conversations such as the one we're having today to just continue to share all of the things that we are experiencing and learning along the way. So with that, we really want to thank you for giving us the opportunity to speak today, and I will hand it over to Justin.
Thanks, Kenworthy. Let's see here. Yeah, thank you, in fact, to all the speakers for that great walkthrough of the importance of unlocking AI in primary care. We now like to open the floor for any questions that you have. Please feel free to type your questions into the control panel, and we will attempt to answer as many of those as we can in the time that we have left. While we're waiting for those to come in, just remind everyone that today's session is being recorded, so we will be sharing the recording and making that available to you to revisit, or that you can share with colleagues who weren't able to attend today. So let's, a few questions were submitted while you all were speaking. Let me jump into a few of those. The first one here is, how does AI maintain privacy and security of patient data? Who would like to respond to that?
Yeah, I can take that one. Yeah, it's obviously a really important question that's top of mind anytime a new technology shows up in the healthcare space. Fortunately, we've got a lot of experience handling it. Certainly, our entire platform, including Node Assist, is HIPAA compliant and respects the certifications that we're held to as a certified EHR. We work just like with any other technology vendor, any sort of cloud vendor or third party. We make sure to get agreements that the patient data isn't used to train those models, and we have strict retention limits and safeguards against issues with privacy and security there as well. For Node Assist specifically, we don't retain the audio of the conversations, and we limit the retention of the transcripts. So yeah, it's something that we think about quite a bit.
Yeah, that makes sense. And there's actually, I think there's a few questions around patients, and are they comfortable and willing to allow their provider to use AI during the visit? And what's kind of the workflow for that? How do you have that conversation with the patient?
Yeah, I can take that. I think this is another really great question, and one I think we were asking ourselves too going into this, and we've learned a lot from the providers using that and the patient reaction. I think overwhelmingly so, providers we've worked with have found that patients have been quite responsive to it and have been feeling reasonably comfortable. It's something that, of course, is still on the provider to set those expectations with the patient and make that clear. But I think patients are really seeing the pros of that, of their provider being a lot more present with them and not being, behind a computer screen, really being able to hear them and having really complete follow-up notes. And so, so far, seeing that really get embraced by patients.
That makes sense. I'm seeing one here. Let's see. Are you all looking at integrating ordering of labs or imaging, possibly having a Siri or Alexa-like integration that I could tell it to send a message to staff or a letter to a patient?
That is a fantastic question. So one way that we're thinking about this is effectively, first of all, starting in the encounter. In the encounter, the clinician is making a lot of clinical decisions and often communicating those clinical decisions to the patient. Like, I'm going to prescribe you Tylenol for your headache. Excuse my very simple example. And one thing that we're exploring is how we can effectively reduce the burden of translating those clinical decisions into action. So how can we, identify that you are looking to place an order for medication or imaging and draft up a version of that order on your behalf? According to, the way we think about building AI products, we still want to keep the clinician in the driver's seat. So we want to queue up these orders for you so that you can review them at the very end. And all you're doing at that stage is just clicking send ultimately. Now, there are other opportunities that we can explore further using, similar approach and technology around. So, for instance, I want to draft a particular message to this member of my team, and figuring out ways that we can leverage this technology to make that even simpler and easier to execute. So.
Great. Let's move on to the next one here. Which types of users benefit the most from these AI tools?
I could take this one. I like this anecdote because just this question in general, because I personally, as somebody in the technology org, was really a little bit surprised at some of what I found was counterintuitive about early adoption of some of these tools. Over the past year, we've talked to a lot of early adopters and customers. And one of the trends that's really interesting about this technology is that while so often when new technologies show up in healthcare, they're often adopted by really like tech savvy providers who are hungry to try the latest and greatest. But one thing that we've seen with some of this AI technology is that it has like a really human interaction format. And the providers that I saw having some of the most success early with these AI scribe tools were providers that really struggled with documenting with their chart, and some of the providers that struggled the most with technology in general and EHRs specifically. And so it's been a really heartening thing. But in general, I think broadly it can be really powerful for all sorts of providers, but it's nice to know that it doesn't require an enormous amount of like tech savvy to adopt.
Thanks, Bill. Let's see. How will your AI assist with pre-visit planning for quality performance?
I can take that one. So that's a really exciting space, I think, for us, one that we haven't yet really gotten into with the product, but is absolutely on our radar because a huge part of the burden associated with a patient encounter or asynchronous care is that preparation for it and ensuring that you're setting yourself up for success when you're in front of the patient. So I touched on that before in thinking about, or when I was mentioning that providers really cared about getting more insights from the data they already had and how we can support that. We definitely see AI as a tool to help support this, particularly in our ability to interpret unstructured documents that are coming in. Although, I think that this still could absolutely be supplemented by maybe more traditional technology, and it's just a space for us to grow in more generally. But AI can really help us get that structured data out of maybe things that are unintegrated or faxes, and then be able to manipulate that and show that in an effective way to prep for your visit. So working really like hand in hand with the AI note generation tool.
Thanks, Katie. I guess we can move on to the next one. How will your AI assist with risk adjustment coding?
Yeah, that's a good question. This gets back to some of the points that I was making about how important patient context is for these tools to be effective, especially in dynamic and complex patient scenarios. I do worry that some of these AI tools that, for instance, predict ICD-10 codes might cause challenges for existing patients where maybe you've already gone through the process of coding a complex diagnosis, and you could lead to, accidentally not reassessing the right condition. So I think that's one reason we want to pull as much patient context into Note Assist as possible, so that it doesn't put you into that position. And then I think there's a lot more that we can do. We're kind of just scratching the surface on risk adjustment coding and what Note Assist can do. So I'm really excited to keep pushing in that direction.
That's great. Thanks, Bill. There's one here, kind of a clarification. Am I correct that if the note is to be completed in real time during the patient encounter, the physical exam findings would need to be verbally dictated, essentially in front of the patient as the exam is being done? Is that essentially correct?
Yeah, that's a great question. That's something that we're obviously grappling with, and something we've talked to quite a few providers about, like what the best way for us to approach that is. We've certainly seen scenarios where across the patient encounter where providers are choosing to speak more of their details about the visit and what they're thinking out loud to their patients. And sometimes that can honestly be a benefit. They said that that's really can help them be more specific in their conversations with the patient. But there's certainly times when that could be weird. I think normal physical exam findings is maybe the most obvious example where if it's normal, it's normal. The patient doesn't really want to hear the medical terminology for what that is. So in today's world, we'll just capture, it's normal, or whatever you said, maybe translate that into something a little bit more succinct. But ideally, we would leverage provider templates, and that's where we're thinking about one of those ways where we can take provider specific context from the EHR and use that to fill in those gaps. So you have a standard normal that's going into those places, so that we're not making that logical leap on your behalf without you needing to state that every time. So I think that's like a good example of where we see really like those more traditional workflows and AI working hand in hand to make sure that we're not relying on AI for everything.
Okay, there's I guess a question about the product. How long will the audio transcript records be kept? Are they able to be recalled or subpoenaed, during a malpractice claim in a worst case scenario?
Yeah, so today we don't retain the audio, and we retain the transcripts for a default of 14 days, unless the practice or the provider has raised an issue or filed some feedback that we need to look at it for a little bit longer. This is a question we're interested in getting more feedback on, though. Some providers are really interested in longer retention for the reasons that the commenter mentioned, and Some don't want that. So I think there's a really good chance that this will become customizable in the future.
And along those lines, how will your AI allow for customization of the prompts?
That's a really good question. So the way we think about this is more so along the lines of how we enable clinicians to have control over the documentation experience. And there are, two key ways that that is showing up today. One, as we mentioned earlier, Note Assist will generate the note in parallel with the clinician as they're going through the visit. One key advantage there is that Note Assist is actually aware of whatever content that the clinician puts into the note, right? So if there is a new topic that you want to discuss in the middle of the visit that maybe just came up spontaneously over the course of that encounter, you can either, apply a template that you usually would use for that context, and Note Assist is able to fill in that template and incorporate the discussion into that structure that you're used to. The other way that that shows up, continuing on the path of template incorporation, we really see templates as a way to have the clinician give instructions to the system to Note Assist. So that's one other area where, based on how the template is constructed, Note Assist is aware of sort of the expectations that the clinician has for how that template then gets completed. So those are the two key ways that that shows up today. And we're continuing to think of additional ways that we can, continue to keep the clinician in the driver's seat and give them more control over the system and how it works.
Thanks, Kenworthy. Let's see here. One more. I tend to have longer, more narrative visits, but would like to use AI to listen to me summarize key points during the visit. Is it something I can start, stop easily during the visit? Can it be used for dictation as well?
I could not find the unmute button. That is a fantastic, a fantastic question. So one of the key things that a lot of our clinicians have shared with us with their experiences in Note Assist is that they find it helps them capture the relevant detail even when they're engaging in one of these very long narrative type visit where the conversation is meandering, the patient is talking about I dropped off my kid at soccer and this thing happened, and they're off on this one conversation here. We're seeing a lot of advantage in using this tool because it allows you to maintain that natural conversational relationship with your patient, which is really important, while still receiving organized documentation at the end, right? So that's like one part of how this works. The second bit around if it's easy to pause or resume recording, that is something that we've thought about deeply in the experience of the product, and it's built in such a way that you have a button that's in front of you and you can choose when Note Assist is listening versus when it's not. So you can very easily move through the conversation. You can keep things off the record if you so choose. And the question around dictation, this is an area that we're really excited to explore further. We have some upcoming things in this direction that we are excited to share in the very, very near future. But we do envision having a way for the system to support a variety of modes that the clinician can be in when it comes to documenting. One of them being in dialogue with a patient, but we also recognize that in other scenarios, it might just be the clinician stating summaries of an encounter that you had with a patient and needing that to be translated into a note. And then in other modes, you actually just want to state something verbatim and have it fill into the note. So those are the spectrums that we're looking to support. So we anticipate in the very near future seeing more of a dictation style capability in the product as well.
And I think this kind of goes along similar lines. Are the AI tools like Note Assist used or running during the medical assistant, or nurse pre-post encounter? If so, how?
Yeah, I can take that one. So Yeah, Note Assist is usable during chart prep. You can start and stop and use it for different parts of the visit. In terms of how Note Assist works with multiple members of your practice, we get the question about chart prep and your medical assistant a fair bit. And so that's something that we're thinking about. Right now, you'd need a Note Assist license for anybody using the feature.
Okay, great. So there's a lot of excitement and additional questions around, of course, pricing, expansion, a lot of interest. So we can follow up with all of those questions separately. Really appreciate your engagement there. So thank you all for your thoughtful questions and for participating so actively. It's clear there's a lot of interest and understandably some concerns about AI in primary care. I hope that today's discussion and insights have provided you with valuable information to better understand these new developments. Before we wrap up, I'd like to extend a huge thank you to our speakers, Kenworthy, Phil, and Katie, for sharing their expertise with us today. And of course, a big thank you to all of you for joining us. It's been a pleasure to host this session and connect with so many of you. Elation is here to support your practice every step of the way, from streamlining your operations, improving patient care, and even enhancing your practice's financial health. We'll be sending out a follow-up email with a link to the recording of today's webinar, along with some additional resources that can help you further explore the topics that we discussed. And we also welcome your feedback on today's session. So please take a moment to complete the very brief survey after the webinar session ends. So thank you once again for spending part of your day with us. Goodbye, everyone, and we look forward to seeing you at our next webinar.